So, hi and welcome. This is Laikipia Health Service Doctors Corner channel. A channel that is dedicated to inform and empower you matters you held. Today we're on the western block of the county at Laikipia Health Service, Nyahururu. On set with me, I have a doctor who will be taking us through hypertension and diabetes, what it is, and what we ought to know about these diseases. As per the business plans that were prepared for our various facilities in the county, it was evident that these are the most prevalent conditions among the elderly: hypertension, diabetes, and arthritis among the elderly in Laikipia County. So we're here to help us understand what it means to have these conditions, what is expected of us, and even probably if there's a way for those who have not yet gotten into this group, if there's a way to avoid, prevent, or prolong their lives before they start dealing with these conditions. Welcome on board. Remember, this is Laikipia Health Service Doctors Corner channel. Thank you. Okay. So, hi, Daktari, how are you?
I'm fine, how are you?
Fine, thank you.
Mm-hmm.
Who should tell the other one, Karibu?
We both welcome each other.
So, welcome to Laikipia Health Service YouTube channel. We call it Doctors Corner. So, tell us who you are, where you work, and what you do.
Yeah. First, it's a great pleasure to have you here. And as you welcome me to Laikipia Health Service, I would like also to welcome you to the Nyahururu locality. My name is Dr. Ogado Gascgoine. I'm a holder of MBCHB degree and a general practitioner.
So, specifically, I want you to take us through hypertension, diabetes, and I want us to go through each at a time. So, what is hypertension?
Hypertension, to break it down, it's basically two words. Hyper means high, then tension means the amount of pressure. So when you speak of hypertension, it goes to how your blood pressures are. So when it's above a certain limit, we would say that you have hypertension. In other words, in Kikuyu they tend to describe it as murimo wako haisha bresha, bresha yake ya thakame. Yes.
So, we move to diabetes. What is diabetes?
Right. Diabetes is also one of the chronic diseases that we have. Basically, it's also in two words. Diabetes is more of having increased urination, and mellitus means sweet. So when you speak of diabetes, you mean that someone has increased sugar levels in their blood as well. Yeah.
So, you said hypertension is about blood pressure.
Yes.
What causes it?
Hypertension, when I break it down, ideally there are two types of causes. There is one that just comes, it's not known where it comes from, and to some extent it is a majority. And there is another one that we call it secondary, meaning that there is something that has made it come, something that is preceding it. Yes.
So, this that just come, or hypertension, is it age defined or anybody can get hypertension?
Hypertension can be brought by anything, but there are other factors that can contribute to the onset of it. Some things can make it come faster, and some things, like I said, we wouldn't know about them. But any person of any age can have high blood pressures. Yes.
So, is it a treatable condition or is it a condition that one has to manage through life?
It is something that, depending on the cause, if it has come secondary to something, you can deal with the primary problem and get the benefit of controlling or even dealing with it for good. But if it doesn't go away, that means you need to live with it, meaning that we don't treat it. It's not like something like malaria. We control it and manage it, meaning that we'll use different modalities to keep it at bay or to make them within the aspired ranges.
Okay.
Yes.
Is there a correlation between diabetes and hypertension?
Yes, there is. One begets the other, and the other correlation, they can coexist. Diabetes, as one of the complications that it has, is hypertension is one of them. Yes. But someone can have hypertension at the same time have diabetes when none has brought the other about. They can come at different times, and yeah.
And one can have hypertension but doesn't have diabetes.
Yes, it can be like that.
Okay.
Yes.
So let's switch to diabetes. What causes it?
Diabetes, again, there are different types. Okay, because when you get to know the types, it will help you get to know the causes. There is this type 1, which mostly is secondary or primarily because of there is inadequacy or even a complete lack of the insulin, which is the like the controller of blood glucose. There is this other one which we call type 2, that the insulin could be there, but now how your body is responding, say, because of different other factors, is not in a way that would make you in control of your blood sugars. Yes.
So diabetes, is it age defined, or anybody can get diabetes at whatever age?
Yeah, the second statement is right. Anyone can get diabetes at any point in their ages. Yes.
Signs and symptoms. What do I see in me, or what do I see in a loved one to know this is hypertension or this is diabetes?
Okay. We'll start with the hypertension. The commonest thing, yes, is that silence. It doesn't have these classical presentations, but when there are things that come after it being there for a while, now they can come with complications. The complications could be from headache, could be affecting your eyesight, could be affecting your heart. You'd feel chest pains. You'd feel like you get tired easily. It would also affect your lungs, your breathing develops problems. So and you also have these chronic muscle pains. It's a very non-specific kind of disease. Yeah, hence we call it the silent killer.
Okay.
Yes.
So by affecting breathing, could an increased heart rate be an indicator of hypertension?
Yes, it can.
Okay.
And when your heart rate is increased, you tend to feel it's not a precise thing, but you'd have an awareness. That's when people come and say, nasikia roho ikipiga sana. Yes, in medical terms, that one we refer to as palpitations.
Okay, diabetes.
Diabetes, like from the name, the common things that you'd come around is patient will describe their urination to have increased. So we say there is polyuria. Poly means in several numbers, and urea is urea means urine. So they would be urinating multiple times over the day. Now, since there is that urination, it means you're depleting the water volumes in your body. So your body also tends to respond by increasing your thirst level. So the patient would be describing it as having kushikwa na kiu sana, kohota in konyota, or kohota in konyota. But they can also have kohota, yeah, because that increased demand of energy, the energy giving nutrients in that we take in, that increased demand also makes our brains to send a signal to us that we need to eat more. Yes.
I've seen people who the diagnosis of these conditions scares them. So some do not adhere, say, to what is expected of them by the medics. So are they such conditions that should worry somebody or even make somebody give up on life?
Okay. This one is a multiple kind of question, because it involves so many other professionals in the medical fraternity. I, as a doctor, the moment I make that diagnosis of diabetes or hypertension, and I start you on medication, depending on the level of my convincing you, there are also other professions that should be involved. Giving up on life, like you're saying, I think now that moves to become a psychological condition, where a psychologist or more so a psychiatrist can help you deal with, because it's at the level of the mind. Yeah. Yeah.
So probably to phrase that question, are these conditions treatable? And if they're not treatable, what is the longevity? For how long can somebody stay on maintenance, if I may say so?
Okay, well, the longer you are on drugs, the duration of us giving you these drugs and the duration of your condition, it's highly variable. It's highly variable. So there are people who can come with the diabetes or the hypertension, then we get control faster. There are people who take longer. But in a nutshell, most of them tend to go for a long period of their lives with these conditions. Yes.
Okay.
Yes. So I think the best description for them is not treating, because when you're treating, you're looking for healing. But in the aspect of these two conditions, we are looking for controlling.
Okay.
Yes.
Okay.
Yes.
So as I said earlier, Laikipia has recorded, or actually the most prevalent conditions among the elderly are these two, with an addition of arthritis, especially here in Nyahururu. So is it lifestyle or it's something across the country?
That's a very good question, because when you think of it as the elderly and lifestyle, you would again ask yourself, what are their lifestyles? Okay, so these elderly people, you might find there are two types. There's this group of the elderly that develop the diabetes after their 50s or in their 60s, and there is this group that has come into their elderly stage of life with with the condition having come with them from their younger years. But from the trends is diabetes and hypertension more so is coming from the lifestyle that we are currently living in. And the lifestyle means your activities or inactivities and your diets and also your health-seeking habits. Because the diet here is, to me, it's the commonest culprit. Because the kind of the culture in the eating is a little bit worrying. For example, people tend here to eat moshere na waru. That's one I've observed is the commonest combination. Yes, moshere na waru. You see, these are all carbohydrates. Okay, and there's a consequence of taking that amount of carbohydrates in one sitting or continuous. So, and you see, that is a lifestyle. You've chosen to do this. Yeah.
Okay. So probably to have this, then it's the lifestyle and nutrition that we need to act on.
Yes, it would, when we concentrate on these two things, not forgetting the others. When we concentrate these two, I think we'll make a big headway in curbing this problem. Yeah. Yeah.
So currently, due to this, LHS has moved to having decentralized MOPC clinics, if I may call them that, whereby they go to the facilities at the mashinani for drug refills and even patient reviews. What's your thought on this?
That's a good move. That's a good move because currently here there are crazy days, I would call them, because I would see me and my colleagues would see like 50 patients
In a day.
in a sitting. And normally us the people who are seeing them, we are at an average of 4 or at most we are 6. So imagine you seeing 50 to 80 patients almost every day in the working days, Monday to Friday. The quality is really compromised. Quality is really compromised. So this move of decentralizing it's a welcome move, and I really appreciate that from the LHS.
Okay.
Yes.
On speaking about this MOPC, because you've handled them here, so when people are going out there for an outreach, what should it comprise? Apart from the drugs and maybe the doctor who is reviewing, what else should be added into it?
Prevention is better than cure. Again, diabetes, hypertension, you don't cure. So why concentrate on something that you wouldn't achieve much and lose concentration on something you would achieve much? With prevention, I think we can achieve much. These outreaches should move or incorporate more of preventive kind of medicine. Yeah, here I mean a lot of information should go out there. Yes.
Okay.
Yes.
So as we are coming to the tail end of this interview, I want to give you a chance probably to speak your mind to the viewers who will watch this clip. Matters hypertension and diabetes. What is your appeal to them?
Okay. My appeal to the general public, everyone in Laikipia, including myself, don't wait for the problem to come or to show another problem. What should you do? Get screened. Get screened. And the screening is not a one-touch thing. It should be continuous, because the resources are there, and some of these things are very easy to do. See, for measuring blood pressure, it doesn't cost anything. The machines are readily available, so getting into the habit of checking your blood pressure frequently would go a long way of getting to know if you have hypertension early enough. Also, your blood sugars. We like one of the tests we do is random blood sugar. See, even from the word random, you don't need an appointment. You don't need to have any symptom. Just do it. Just do it. Yeah.
Okay.
Yeah.
When we speak of normal blood pressure, you see, mostly we go get that thing put on the arm.
Yes.
We see those numbers.
Yes.
It's only the doctor who understands what those numbers are
Yes.
saying. Is at this level, you're okay. If it's beyond here or below here, you're not okay.
Okay. Blood pressure is it's a very interesting thing to the patient and our clients. In a nutshell, what I would tell you is there are two parameters in that blood pressure we look at, and there's also with the digitalized machines, we have another aspect of the pulse, how fast your heart rate is beating. So I will leave that on at that and go back to these two blood pressures. So when we measure, we will go and write it a certain number over a certain number. Okay? So there's the top one and the bottom one. For the top one, a good range would be somewhere from 90 all the way to 139, the top one. The lower one, a good range would be from 60 to somewhere around 89. Okay, so knowing these ranges is also important for you, for the people like Laikipia, because at times we worry so much, and because we don't know these ranges, we can worry so much, and worrying is also one of the contributing factors to elevated BPs. So getting to know these ranges and familiarizing yourself with would be a good thing.
Okay.
Yes.
Thank you very much, Daktari. So that is it from Laikipia Health Service, Doctor's Corner channel this week. You've heard it from Dr. Ogado. The things we need to know about hypertension and diabetes. And I want to emphasize this because personally, anytime I go in that thing,
the BP machine.
Yes, the BP machine is rolled around my hand. I always tense because I don't know what is expected to appear on that screen. So from him, he says that a range of 90 to 139 on the numerator, that is the number on top, that is the normal range. A range of 60 to 89 on the denominator, that is the lower figure, that is the normal range. So if it's anywhere below or above these figures, then you have a reason to be concerned. And just to emphasize, there are BP machines in every of our facilities, and getting checked is totally free of charge. So as he has said, let us normalize taking care of our health, not because we're feeling something is out of hand, but because we want to be safe. As he says, prevention is better than cure, and truly we all know there is nothing better than just preventing yourself. That is it for this week. We'll meet next week on another edition. Keep safe. Thank you.